Welcome back to Face the State. I'm Ariana Bennett. Thank you for joining us. Well, if you've never needed to seek low-cost health care or find help getting treatment without insurance, you may not have heard of the Community Health Alliance. But these days, with the Affordable Care Act taking effect and open enrollment in its second year, the organization has an even bigger role. Chuck Duarte and Tracy Evans from the Community Health Alliance are here to tell us all about it. Thank you both so much for coming on the show.
Thanks for having us.
All right, Chuck, I'm going to start with you to just give us a little rundown of what the Community Health Alliance does, what it's all about.
Sure. Community Health Alliance is a nonprofit group of community health centers. We have 4 in the Washoe County area right now, soon to be 5, with one opening next Tuesday at Worcester High School. We also have a variety of mobile programs, including dental vans. We have nutritional programs, and we also have a very large dental clinic and medical clinic located on Wells Avenue. So we're the largest provider of primary medical and dental care for low-income households and individuals in northern Nevada.
So who do you typically serve? Is it a wide range of people? Is it, homeless people, low-income people without insurance, people with insurance?
Well, we'll serve anybody who needs health care. And you can come in, and if you don't have insurance, we'll help you get insurance. And even if you can't get insurance, we'll help take care of you at very low cost. So the folks that we normally see, like I said, are low-income families. A large percentage of them are Hispanic. And so we try to provide care in a culturally sensitive way. All of our frontline staff, they speak Spanish, and they can help patients with all their care needs, as well as our providers, many of whom speak Spanish.
How does payment work then? I mean, since are you guys operating under a different situation than most hospitals? Obviously costs are incredibly high, and most medical care is incredibly high. How do you keep the costs low?
Well, first of all, we're pretty frugal. As a nonprofit, we do our best to try to keep it cheap and inexpensive, but keep the quality high. But the other thing that we have is a special federal status, which allows us to get reimbursed by programs like Medicare and the state Medicaid program at slightly higher rates than a private practice would. So that allows us to see these patients and also take care of patients who are uninsured. So with that type of revenue, as well as grant funding, we're able to not only take care of patients with insurance, but those without insurance. Has
the day-to-day changed quite a bit since healthcare reform made so many more people have insurance?
Absolutely. The decision of the state of Nevada to implement the health insurance exchange and expand the Medicaid program, in my opinion, is one of the foundations of healthcare improvement and health status improvement for all Nevadans in the future. It's the first step, it's the basement, it's the foundation of everything that we're going to be doing in the future. People with insurance are going to be able to get their care needs met. They're going to have preventive care options available to them that they didn't have before. We need workforce. We need healthcare providers willing to see these people. And so there's a lot more work that needs to go on. But giving people health insurance is really fundamental to making sure that we can improve the health status of Nevadans in the future.
Okay, and speaking of giving people health insurance, Tracy, that's kind of where you come in. I know the open enrollment process can be very confusing. I know first round was riddled with issues. This time around seemed to go a little more smoothly, but still probably a lot of misconceptions and confusion where it's concerned. Just tell me a little bit about what you do helping people get enrolled.
So we have a team within Community Health Alliance of 6 assisters. I'm kind of the lead assister. And what we do is outreach to the community, and we welcome walk-ins to come in and see us, and we will help them with their enrollment in either Medicaid or a qualified health plan. During that time when we're doing the enrollment assistance, we also try to educate them as much as possible, because some have either never had insurance or don't know how that works. So we educate them about deductibles, co-insurance, co-payments, what their out-of-pocket maximums would be, how to look for their insurance through their healthcare provider. Do they have a particular provider they'd like to have? Do they have a particular hospital they'd like to go to? Are they taking prescription drugs? So there's a lot of education that we try to provide, as well as the enrollment assistance.
So you kind of walk them through the process?
Yes.
How long does it take to get enrolled?
Well, and it really depends, Ariana. It's you can make it as short as half an hour if we just want to go through the enrollment process and do an application, but we try to educate them during that process. So we have some people that'll take half an hour, other people will take up to an hour and a half, and we've had people go as long as 3 hours.
Really,
and the important thing to remember is that it's a free service, so people can come in and get free assistance.
That's actually a lot less time than I would have expected. I mean, based on what I've heard in the past, I would have thought it would take longer, but 3 hours maximum doesn't seem that bad.
It isn't really, I don't think, for all the education that we give, and it's really as much as the people need, we're there to give that help.
Have you seen more takers this year compared to last year? How has it been numbers-wise?
Actually, it's unusual because we're seeing a lot of people, but not quite the volume we saw last year, and that's mainly because this year, anybody that was previously enrolled is automatically re-enrolled by their insurance carrier. So some of those people are not coming back to see us. We believe before February 15th, they might want to come back though, because their life status may have changed. They may have either gained employment, gained a raise, or lost income, or their family size changed. So they may need to make changes to their accounts.
What kind of misconceptions or misinformation do you hear most common? Are there a lot of myths?
I think a lot of people are unaware that everything with the Affordable Care Act, when you're going to enroll in a plan, is based on your tax household. So that's probably the most important thing, and you're going to hear a lot now that it's tax time about tax households, and it's based on your income. So tax household and income is where we start, and providing that information for all citizens that are legally present.
Are there still a lot of people, and I don't know if maybe you've encountered them, who are resistant to the process, don't want to enroll, don't want insurance?
Of course, there's a lot of people that still kind of come in and talk about the whole political debate. They believe that maybe now with a Republican legislature and Republicans in the Congress, that things are going to be overturned. And so our main thing when we do presentations is, it's the law until it's not the law. And how many laws have we seen that have been overturned? That would be a hard process to do. So our main concern is, don't get caught up in the IRS finding you penalties because you don't have the health care. And those penalties are increasing. They're multiplying in 2015, which people will see in 2016.
Yeah, that's something I've learned a lot of people maybe didn't realize, because the penalties were relatively mild the first year. It was $100 or something like that, not that much. They're more than doubling this time around. So I think a lot of people maybe don't know that if they, they thought they could just pay the penalty and not worry about insurance this year. That's not a good idea.
Well, and a lot of people were just hearing that $95 and assuming that they were at that $95 penalty rate. They don't realize that $95 is for people with a lower income under $20,000 a year. You have to add for everybody in your tax household. So if your kids don't have coverage, if your spouse doesn't have coverage, that's an additional tax. So it's not just one $95 fee for the whole household. It's worth finding out the information, and we're happy to provide that at no cost.
And that is money that you're paying for nothing. You could pay that and not get anything for it, or you can pay money and get health insurance, which, is a helpful thing to have, I found. For me personally, it's helpful.
Well, and if people want to give up 1% of their income for 2014, I'd be happy to take that. Sometimes we can find affordable coverage that isn't going to cost them anything.
Really?
After the advanced premium tax credit, they sometimes can find a coverage and not pay a fine, and they wouldn't pay anything.
Wow. So there are some plans that are actually that inexpensive.
Yes.
Wow. I didn't know.
Yeah. And most people don't know. So it's free to go. And as a woman, why not shop? Why not find out what's available to you? It costs you nothing but your time. Why wouldn't you come and find out?
Right, and it probably helps you guys out too. I mean, having more insured people means you have to do a little less financial finagling, right?
Oh, it's been a tremendous benefit for us. We started prior to this with an uninsured rate of about 40% of our patients. And today that's down by half, so about 20% of our patients do not have insurance. And Tracy and her team are working on that right now. So a lot of folks do qualify not just for low-cost health coverage for the exchange, but for Medicaid. And I think, getting back to the concerns that a lot of folks express regarding things that could change politically, I think it'd be pretty tough to go backwards and see 300,000 Nevadans lose health coverage through Medicaid or the exchange. I think that'd be a pretty tough step for anybody to take. And like I said, this is the foundation for health improvement for Nevadans across the board, not just for those with insurance, but for all Nevadans, because the less often they have to go to the emergency department, the less we pay as insured individuals when we have to pay our premiums. So, it takes care of not just our own costs, but the costs for the community out there. And again, for us, it's a tremendous benefit because now we can provide high-quality care to patients who otherwise couldn't afford to pay for it.
Yeah, that makes perfect sense. Okay, we just have a few minutes left. Is there any advice you'd want to give? I mean, really either of you, but I mean, for someone who might be considering enrolling, has been a little hesitant about it, or thinks it's just too daunting of a task, they're overwhelmed by all the options.
It really only takes 3 pieces of information for them to bring: their picture ID, their social security information or their resident alien cards, and proof of income. And why wouldn't you come down, check us out, see what options are available to you? It costs you, again, nothing. If you walk out and don't purchase anything, that's fine. But you would at least know that you're subject to a penalty, you've done your homework, and then you can rest assured that you've done what you need to do for yourself.
And it is free to pay you guys.
It is. It is free.
All right, awesome. Well, to get more information on the Community Health Alliance or find out where to meet up with them, you can just head to our website, ktvn.com. I've posted a link there for you under the News Links tab. That is it for this episode of Face the State. Thank you both for coming on
Thanks,
the show.
Ariana.
Thank you so much.
Thank you, Ariana.
All right. For more information or to see past episodes, you can just head to our website, ktvn.com. Once again, thank you so much for joining us. We will see you next week.